Hi, I'm Chris Bridle.
And I'm Steve Laville.
We work for NHS Leeds West CCG, which stands for Clinical Commissioning Group. There are 3 CCGs in Leeds. They're responsible for planning and buying health services for local people.
An important role of the CCG is to make sure that the services we provide are as effective as possible. My role as Head of Planned Care Transformation for NHS Leeds West CCG is to make sure that the services we provide are affordable and effective. This means, occasionally, having to change or redesign services to make sure that they deliver the best possible service. We do this often as a result of feedback from parents or carers or patients themselves, as well as from healthcare professionals.
When we make changes to services or redesign services, it affects you. It also affects the people who care for you, your family and your friends. It's my job as the engagement lead to make sure that when we make changes to services, we listen to what patients, carers and the wider public say and act on the feedback that they give us. We've made this film because we're making changes to chronic pain services in Leeds, and we want to know what patients and the public think of the changes we're proposing. If you live in Leeds, these changes could affect you, and we'd like you to tell us what you think by filling in our patient survey. There are a few ways that you can fill in the survey. You can follow the link on the screen to our website. If you're watching this on YouTube, you can follow the link that's in the description to the film, or you can fill in paper copies of the survey at your local GP practice.
So what is chronic pain? Pain is a perfectly normal sensation that we all get now and then, and often it's a very good indication that we have some kind of illness or injury. But chronic pain is quite a different thing altogether. That's defined as persistent pain that lasts for more than 12 weeks. It can have a devastating impact on people's physical and mental well-being, and sadly, often it can't be cured. So what changes are we trying to make? At the moment, services are still very much focused on trying to find a cure. We still want to retain that element of service, but where that's not possible, we want to make sure that patients receive better support so that they can understand their condition more and are better supported in being able to cope with it. There's very strong evidence that by adopting this approach, patients feel the impact of their pain less and have less disruption to their daily lives. And please remember, this survey is open to everybody, so you don't have to be a current patient, and you've got until Friday the 10th of October to let us know what you think.
After the survey's closed, we'll look at what you've told us to see if we need to make any changes to our proposed plans. If you leave us your details, we'll contact you after the engagement to tell you how your views have shaped future services.
We hope this gives you a better understanding of why we're asking for your views and why it's so important that you get involved. Thanks for watching.
Goodbye.